Well, welcome. We're glad to have you here with us this afternoon. We're so excited to get to visit with you today. We're going to be talking about the importance of self-care, preventing professional burnout. And I'm going to let my colleague and my boss introduce herself first, and then I'll tell you a little bit about me as well.
Thank you, Dr. Farmer, and welcome everybody. This is such an exciting partnership to be able to visit with you on this topic. I'm Jessica Rangel, and I'm the Vice Provost for Academic Innovation. I am a nurse by trade, and I am a nurse at heart and always will be. And I'm excited to talk to you about this topic because both Dr. Farmer and I are right there with you. And these are issues that we too have been dealing with among our own staff and students. So this is going to be a great conversation. I appreciate the invitation.
Thanks, Jessica. And I'm David Farmer. I'm the Director of Interprofessional Practice at the University of North Texas Health Science Center. There I also teach medical students. My background is psychology. I'm a licensed professional counselor and a licensed marriage and family therapist. Was in practice 23 years before coming to the University of North Texas about 12 years ago. And I teach medical students how to communicate with their patients and with each other. And this is we are living this with you very much. We are faculty, we do teach, although I'm not going to say that our experience is anything compared to K through 12. I'm married to a kindergarten teacher. My wife has been a teacher now for over 40 years. It was interesting as the pandemic began, we were both teaching from home. She's now back on her campus. I'm still at home. But she was at the kitchen table and she would have Zoom going with kindergartners. And I was in the study, not very far away, on Zoom with medical students. And I could some of what was going on with her kindergartners. And I have to tell you, some days I couldn't tell the difference between the kindergartners and the medical students. There was a lot of similarity. And so we're going to be talking to you some today about preventing burnout. The other thing I forgot to tell you that I did, I was on a school board for 12 years, one of the fastest growing school districts in the area during the time that I was there. So these are our objectives, 3 objectives for today. We want to define burnout, identify its causes, its signs, and its symptoms. We want to define resilience and identify sources for developing resilience. And then we want to apply self-care strategies and resources for preventing and managing burnout. So our hope is today that you're going to walk away with 1 or 2 things that you're going to say, hey, I want to apply this immediately as I go back and think about where I'm at in this process. Now, we're going to give you a definition of burnout. It's a prolonged response to chronic emotional and interpersonal stressors on the job defined by 3 dimensions. And these are the 3 dimensions: exhaustion, feelings of being overextended, depleted of emotional and physical resources; cynicism or depersonalization. It's a sense of callous or excessively detached response to various aspects of the job. And then inefficacy, feeling of incompetence and a lack of achievement and productivity at work. Now, these are the way teachers, as you look at responses from teachers, now this is not every way that they've responded, but this is how teachers have described some of the symptoms of burnout. They've described it as a feeling of unfulfillment in their work, an overwhelming mountain of work, constant meetings, and ongoing sacrifice of personal time. They've reported feeling overwhelmed, can never get it all done. Frustration at no ability to change the system, exhaustion emotionally and physically. Felt inability to meet expectations from administration, parents, standardized tests. Here's one: sleep deprivation. Now, hopefully none of you can relate to this one, but sleep deprivation, stress and lack of self-care, and then weight loss and weight gain. And we looked at some of the questions that you've asked. There was a pre-survey with some questions, and we're going to try to answer some of those questions during the presentation. And then at the end, we've reserved some time to try to express those more. But I remember a question in there about, can stress lead to weight gain? Okay, and it really can lead to either weight gain or weight loss. And actually with the sleep, you find some people sleep more and some people sleep less. And so you'll find some variance in those symptoms. Now, we're going to take a survey. Keelan's going to launch a survey for us here. And what I want you to do is to choose one of the responses. Okay, so this is a burnout survey. This is looking for the status of where you're at this point. I enjoy my work. I have no symptoms of burnout would be the first one. Occasionally I'm under stress and I don't always have as much energy as I once did, but I don't feel burned out. I'm definitely burning out and have one or more symptoms of burnout, such as physical and emotional exhaustion. The symptoms of burnout that I'm experiencing won't go away, and I think about frustration at work a lot. And then the last of these is I feel completely burned out and often wonder if I can go on. I'm at the point where I may need some changes or may need to seek some sort of help. Now, we can't see who's responding to what. These are anonymous responses. And so we're just trying to get a sense of where people are at.
Waiting just a little bit longer for everybody to have a chance to respond.
And, it is okay to have these feelings. I think this is the beginning discussion to really just let's look at how we're all feeling. And the beauty is that you're not alone. Wherever you land on here, you are not alone. All right.
So it looks like the majority are falling there in the occasionally I'm under stress and I don't always have as much energy as I once did, but I don't feel burned out. That's positive. So what we want to do is we want to make sure that you're continuing to build that resilience. We want to look and help you, establish what are those tools or strategies that you're using so that you don't move into the burnout. We've got about 34% of our respondents that are in that initial stage of burning out. They have one or more symptoms of the burnout. And so we really want to begin to identify it early so that we can help you work on that to begin to manage that and to reduce it. And then we do have some 14% that are really beginning to experience those symptoms and 8% that would probably be in that more severe range of burnout. And so, as we go through this today, hopefully we're going to have some discussion that will help you no matter which of these categories that you're in. So let's go through it together and see if we can find some ways of helping us to manage and to prevent burnout. Now, the prevalence of burnout, we know that burnout rates are very high, and I want you to really pay attention to this part that's at the top of the slide here. Teaching like healthcare is a caring profession, and caring professions are highly susceptible to burnout. And so, think about that. You're in this profession because you really, really care about your students. You got into this profession for a reason. And we see that a lot in healthcare as well. People who got into the profession because they really want to help other people. But it is exhausting work. Some research they did with educators and school staff found that those that reported their work always or often stressful was about 61%. So about 61% of educators and school staff reported their work is always or often stressful. When you compare that to the general public, for the general public, that was only about 30% of the general public. So we can see that stress rates are very high for educators. Some of those top causes of burnout, certainly COVID-19, I put that as the top of the list. It's really changed all of our worlds. It's changed the way that we work, where we work from, how we work. My wife's a kindergarten teacher, and she talks about the daily struggle to keep those masks on her students. She mourns over their inability to play together at recess. And so, that COVID-19 has just changed everything. Lack of autonomy, educators talk about that lack of autonomy to make their own decisions, to make curriculum decisions, to make decisions about what they think is best for their students. Student behaviors are certainly on that list, including disrespect, inattentiveness, and sociability. And the sociability can go really different directions. Those that are overly sociable, okay? And some of you may be doing this. I have to confess, I've been in Zoom meetings before. My colleagues are on the screen, and I'll be actually texting with one of those colleagues instead of paying attention to what I should be paying attention to. But then those that are less sociable, that really are very isolated and don't have those relationships. A lack of support from administration. In reality, this tops the list. When you survey teachers, that lack of support from administration is typically one of the top causes of burnout. The hectic environment where you have to rush from place to place, duty to duty, too little rest for regrouping, not enough time to be spent on each activity.
And you know, David, one of the interesting pieces is that just not COVID-19 alone, when we think about, we are bombarded with information nonstop. So even when we walk away from our job, from school, or from the healthcare environment, we're hearing about it on the radio. We want to take a break and go to social media. It's on social media. So it's all about not being able to escape quite a few of these things.
And when you read some of the responses from educators, the whole thing with moving online, one of the things you hear from educators is there's never a break. I can be contacted at any time by parents or students, and I'm having to constantly monitor to see what they're needing at that point. Some of those other top causes: relationship or communication difficulties with parents, a lack of budget for the appropriate materials, lack of time for each lesson or segment of the day, lack of time to adequately prepare, leading to losing out on sleep, family time, self-care, or hobbies. How many of you have sacrificed your sleep or your family time? And then the secondary traumatic stress, what we sometimes call compassion fatigue. You can't help but become involved in the students' lives. I've seen my wife cry over situations in her students' lives, and so she's impacted by that traumatic stress. And then the last one is what we're now calling moral distress. It's that inability to actually live out the values that brought you into the profession. It's just that sense of, I can't do what I had hoped to do. When I did counseling, it would be so frustrating to me that I would work with couples, families, individuals, and I had done it long enough that I knew good strategies that would help them, but it just felt like so often that I just wasn't able to help them make the change that they desired in their life. And it just becomes taxing over time. You wonder, is there something wrong with me? Why can't I do this? And so the good news for today is that burnout's not inevitable. You don't have to be burned out. We need to really address burnout within three contexts: the personal context, your own personality, beliefs, behaviors that foster resilience. We'll talk a little bit about emotional intelligence today, and then some strategies for self-care. We're going to focus on the personal context today, but it is also important to think about the occupational context. What is it about teaching that continues to help contribute to the problem, the profession itself? And then certainly the organizational context, the school district, the education system, and what the system can do to help make some of those changes. But again, today, for time's sake, we're going to focus on the personal context and the impact of the personal context. Now, I told you that we would define resilience today. Resilience is the capacity to recover quickly, the amount of give we have in our reserve as we face threats of significant sources of stress. It's a protective factor in burnout. And I put the palm trees up there because I love to go to Florida. We go to Florida on a family vacation, except for this year, COVID robbed us of that. But I'm always amazed by the palm trees. The palm trees are there, they sway in the wind. And even with hurricanes, many are left over. They're still standing there, so they're resilient. So when you think about yourself as you're facing stress, you're kind of like that palm tree. Then with the stress, but are you able to recover and to be upright again? This is just, we'll kind of talk a little bit about emotional intelligence and its role in resilience. and self-care. This is a study that was done with 35 chief medical officers at a large hospital, and they were looking at the level of stress and how they dealt with burnout. And they found that 69% described stress levels as severe, very severe, or the worst possible, but the majority were not burned out. It's pretty amazing. The common theme that kept their stress under control was actually emotional intelligence. So lower emotional intelligence actually can put a teacher at risk for burnout. So what is emotional intelligence? So it's a set of emotional and social skills that collectively establish how well we perceive and express ourselves. So that ability to be aware of yourself and to express yourself appropriately, to develop and maintain social relationships, cope with challenges, and to use emotional information in an effective and a meaningful way. These are the 5 components of emotional intelligence: our self-perception, our self-expression, our decision-making, our interpersonal, and our stress management. I'm really going to focus on 3 here for us. I'm going to focus on the stress management and burnout component and talk just for a minute about flexibility, stress tolerance, and optimism. These are the components that make up the stress management and burnout. And I've got the scale off to the right-hand side, the green being high use, the yellow being medium use, and the red being low use. And we're not going to do a poll with this, but I want you to think about for flexibility. Flexibility is adapting emotions, thoughts, and behaviors to unfamiliar, unpredictable, dynamic circumstances or ideas. Do you use that skill at a high, medium, or low use? Stress tolerance, coping with stressful or difficult situations and believing that we can manage or influence situations in a positive manner. We're using stress tolerance at a high, medium, or low use. And then optimism, an indicator of one's positive attitude and outlook in life. It involves remaining hopeful and resilient despite occasional setbacks. Are you using optimism at a high, a medium, or a low use? Now, I have to confess to you, we're teaching about emotional intelligence with all of our students at UNT HSC, all of our health profession students, because we've determined it's very important in helping build resilience and then in battling burnout. So we're using a particular inventory called the EQI 2.0, and we've given it to all our students to help them identify areas that they're using at a high, medium, or low use, targeting the low use for growth. And along with our faculty, I've taken it as well. In fact, I've taken it twice. And I have to confess that in the stress management and burnout area, flexibility, in fact, across all of the areas, flexibility was my lowest use skill. And so for the past 2.5 years, I've been working to improve my flexibility. Okay. In fact, I was very encouraged several months ago. I was driving, I have 2 sons, and my younger son, who's 32 now, we were driving together, and he told me about something that he thought would probably bother me. He kind of stammered around to tell me about it, but he was telling me it was going to meet with my disapproval. So he's driving down the road, he tells me about it, and I took a second and I said, I really think that can be okay. That can work out okay. He looked at me abruptly and he pulled over to the side of the road. He stopped the truck and he said, "What's wrong with you?" And I said, "What do you mean, what's wrong?" And he said, "You've never responded that way before." And I said, "Well, I'm working on my flexibility." So I took that as a sign that I've made progress in my flexibility. As you identify these areas, sometimes it's helpful to find someone, a colleague that we work with that's higher in an area. One of my colleagues who works in my office is very high in optimism. So it helps. Optimism is another one that I'm not the highest in, but it helps as we bounce things off each other. She takes a more optimistic view. Sometimes I take a pessimistic view, and sometimes we land in the middle with that. So it's helpful to me. We know that high emotional intelligence actually supports mindfulness. And mindfulness is an in-the-moment awareness of our emotions through our bodily sensations, the environment, and its impact on us. I want you to stop for a moment. I want you to think about something, because one of the questions we had in the survey was about how do we recognize when we're really stressed out? What if we don't know whether we're stressed out or not? And so sometimes we lose that sense of paying attention to our own body responses. So I want you to try something with me for a minute, if you would. I want you to, we're gonna do just some brief relaxation. And here's a disclaimer real quick, or a precaution. If you have particular musculoskeletal issues, okay, neck pain, shoulder pain, you may just want to listen as we go through this. You might not want to participate because we don't want to aggravate any problems that you might have. So try this with me for a minute and let's see how this works together. I want you to try and take, and I want you to tighten up your forehead as much as possible. Make those frown lines show up the best you can. Can you do that for me? And hold it. Hold it. Feel the tension that's there in your forehead and in your scalp. Can you feel that tension? Now slowly release, and let that tension drift down. Do you feel the difference? Do you feel the difference as you release? Now I want you to tighten up your jaw. Tighten up your jaw as tight as you can. Pull it tight, hold it tight. Slowly release. And feel the tension drift out of your jaw. Notice what it feels like with the tension gone. Now already I felt mine go down into my neck, so let that tension go into your neck. Tighten your neck as tight as you can. Those muscles in your neck, tighten it up. Feel how uncomfortable that feels. Now slowly release it. Feel the tension flow out of your neck. Feel how much better that feels. Now my tension's moved into my shoulders, so take your shoulders, tighten your shoulders as tight as you can. Feel the tension that's there, the uncomfortableness that's there. Now slowly let the tension move out of your shoulders, down into your arms, and into your hands. Feel how different it feels as the tension moves out of your shoulders. Now tighten up your fist as tight as you can. Hold them tight, make your forearms tight. Feel the tension that exists there. Feel that tension. Now slowly unfold your fist, straighten out your fingers, let the tension drift out through the end of your fingers. And feel the difference. Now, can you feel some difference? Already I feel a little bit better at this point. And so it's becoming mindful or aware of what's going on. Our body is a good indicator of the tension that we're experiencing. If our neck is hurting, our shoulders are hurting, it's probably because we've tensed up. So mindfulness involves paying attention to our emotions and our thoughts, suspending judgment about them. You ever had those thoughts and you're already getting on to yourself about those thoughts? You ought not think that. You shouldn't think that. You know, oh no, why is that thought coming back? So suspending judgment, just allowing ourselves to know that the thought is there, to explore what the thought's about. And it can also be an opportunity to relax and regain your equilibrium or your balance to help you cope with the stress that we're feeling. So the exercises that we'll talk about today involve allowing yourself to be mindful of what's occurring. So paying attention to your body. Look in the mirror. What's on your face? Are you wearing a frown at that point? You know, it probably tells you something that's going on with you. Jessica, you want to add something to that? I saw you smiling. It looks like you have something you might want to say about it.
No, I think that's beautifully said. The one piece that was very interesting is often, like even now, everyone, where is your tongue? Is it pushing against the roof of your mouth? Indicator of stress. Relax your tongue, let your jaw relax. And so I had a colleague point that out to me at one point. And again, sometimes stress sneaks up on you and you just don't even realize what you're harboring in your body. So I think that was beautifully said, Dr. Farmer, and specifically on your strategies to reset your mind and body. Breathe. Simple enough. We do it without thinking about it. But this is a technique that is utilized in the military and various different places, that even in a stressful situation, being mindful of breathing in and breathing out and slowing your breathing will help to lower your heart rate and begins to lower your stress level. So that is that first one makes me smile.
So the breathing,
Yeah.
I can tell you when I go to the dentist, I practice that. I sit there and breathe because I get very anxious. And so we tend to shallow breathe instead of deep breathing and being aware of our breath. So just try a simple exercise of sitting down and take a deep breath, hold the breath in and count 1, 2, 3, 4, 5. And then release the breath. And as you release the breath, count 1, 2, 3, 4, 5, so that you can feel that you've exhaled that air. And then pull it back in, slowly counting to 5. So some deep breathing exercises that Jessica's completely correct will help us to calm down. Another of these strategies would be to enjoy music. Whatever your genre of music is, just to sit and to listen to that music. And so you might take a few minutes during the day. I have a long commute to work, although pleasantly with COVID, I've not had to commute. But when I did, I would enjoy just listening to the music on the way to work. It would be a time to help me to relax or to think during that time. Practice movement. I will find some days that I've sat here in my study for 8, 9, 10 hours and haven't gotten up and walked around. So just practice movement, whether you're walking outside, walking in the house, just take an opportunity to move around. Experiencing nature. Sometimes we forget that nature is occurring around us. And so for some reason, I guess I'm just noticing more. We have a plethora of squirrels in our neighborhood all of a sudden. And it's hilarious to watch the squirrels. My wife came in one afternoon and she was aggravated. And she said, "Have you been digging in my plants out here?" And she has some plants out around the back of the house. And I was kind of like, "No, why would I dig in your plants?" And so it didn't make any sense to me until I was watching one afternoon. And there's a squirrel that I noticed that's coming up and he's burying nuts in my wife's planters where she has the plant. So I was telling her about it. So every afternoon she has to go back out there and put the dirt back in where the squirrels pulled it out. So just take time to watch that nature around you. You can certainly pray or you can meditate. And it's just taking a moment to think about those pleasant things that you would think about in life. Okay. Sometimes it's just an opportunity to clear your mind. Okay.
Yes.
To have to not think about anything in particular during that time.
Let me take this one, the thinking appreciative thoughts. For those of you who are research nerds like myself, there's several studies out of NYU and some other places that say that if you wake up every day and meditate on and concentrate on 3 things that you're grateful for, articulate it, just specific, be very specific, and do that every day for 6 weeks. It is amazing how it turns around your mindset. It's amazing that it actually can change those wonderful chemicals of dopamine within your system and change your view on how you see the world. In other words, there's good and bad. You have a choice which you observe. And it has been shown that thinking of 3 things that you're grateful for every day make a difference. And I struggle with that. I still make myself do it, but there are days I try to say the same 3 things, but be specific and call it out. And it just releases those wonderful hormones and starts your day off right. That's a great one.
You know, we have right at our hands, I have my cell phone. I see this picture. I pull my cell phone out multiple times per day. And I'll look at these pictures that I've accumulated of my grandkids, and I get a warm feeling inside. Okay, and often when I do that, I'll pray for them and I'll think about them. And I'll remember the fun that we have together. And so it's amazing how it lifts me during the day. It can be yesterday was a very difficult day for me. I felt very overwhelmed with several activities, and I would just constantly pulling out my phone, looking at my picture of the grandkids, and it would give me a lift during that time. And I feel like, okay, now I can go on. And then 30 minutes later, I was pulling it out again, looking at it. So those appreciative thoughts. Recall a humorous event, all right? It's amazing what humor can do to help build our resilience. And so we're not talking about making fun of other people, but it's just thinking about something funny that's happened. My mom tells a story of being with my daughter-in-law and my granddaughter, and my daughter-in-law was baking cookies. She told my granddaughter, who's in kindergarten, she said, "I need some flour." And my granddaughter ran into the pantry and grabbed the can of baking soda. She didn't know the difference, so she grabbed the can of baking soda and she ran out there behind her mom, and her mom turned around quickly and bumped her, and the top popped off the baking soda, the baking powder, and it shot up in the air and went all over my granddaughter. And my mom tells a story of how shocked my granddaughter was. She was covered with baking powder all over her and had this look like she didn't know what to do. And it's just funny as I remember that, and knowing my granddaughter, it's so funny to think about. When I do that, all of a sudden I start to feel happy. I feel good. Okay. It releases endorphins in my body, neurotransmitters that help me feel better, natural painkillers within the body that make us feel better. And so recall a humorous event. Share your thoughts and emotions. I don't know how many of you are like me, but I'm a stuffer. You, the rest of you, a stuffer? Do you stuff your feelings and your thoughts inside? And we really need to share those thoughts and emotions. Okay. There's only so much we can keep inside, and we need to share those. So find colleagues, find family members, find friends that you can share your thoughts and emotions with.
Can I add something to that? Interestingly, a lot of us just don't have time to go and find a group to hang out with or to Zoom with. But you know what I have found, even on various social media platforms, that you will find somebody other, for myself, there's other nurses and other medical professionals that are dealing with COVID-19. So we have our own chat group where we can just talk about how we're feeling. And so it doesn't have to be this formal Zoom meeting kind of thing that, or even going and having coffee with somebody, which is wonderful. But I don't know about you, David, but I just don't have that kind of time. So even if I have a chance to chat with David about something, even though it's work, it's sort of a bonding and a mind relief for sure.
So it's those communities of support. We all need those.
Yep.
And so, Jessica, earlier you talked about social media, how we're bombarded. I think we need to be careful with social media, because there's often in social media, we'll get on sites where there's a lot of blogging and a lot of negative talk or pessimism.
Right.
So as we develop these communities of support, I think we want to look for those that are realistically positive, that help us focus on what are some of the positive. Yes, we live in a very difficult time. COVID is a very difficult experience for us, but we want to look for what are the good things that are coming for us in life. What are the things that we can look forward to and that we can enjoy? A few more of these strategies. Take personal or wellness days to recharge. One of the things we find within the medical profession is with burned out individuals is we find that often they don't take time off. They don't take vacation days or wellness days. And I know it's very difficult. In my wife's school district, it's very difficult now to get a sub. And a lot of that probably has to do more with her perfectionism, because she wants particular subs. But we need to take those personal or those wellness days. Remember the whys of what led you to teaching. Remember that moral distress that I talked about. Why did you get into the teaching field? And reminding yourself of that, finding hope in that. Celebrate the small victories daily and weekly. What are those small things? Sometimes I'm looking for those big victories, and instead, maybe I need to find the small ones that occur across the day. And then this next one, take your lunch break and eat. Trust that it can be done well enough. I told you my wife's a kindergarten teacher. I can't tell you the number of days that she doesn't get her duty-free lunch. Now, a lot of it's because she tells me that her kindergartners still need a lot of help. And so she says there's not enough help in the lunchroom to help them with that. So I have to stick around and help them to open up their milk cartons. Now, I'm meaner than my wife is. I'm not near as understanding. So I tell her, hey, it's about survival of the fittest. If they can't get into their milk, they don't deserve their milk. So she reminds me that our granddaughter Sutton is in kindergarten, and she says, how would you feel if Sutton couldn't open her milk carton? So usually what I tell her is, I feel certain that Sutton would gnaw into it if she had to get into her milk. But my wife misses that. So take your lunch break. You know, how many of you are not taking your lunch breaks and not eating? Practice setting realistic expectations. One of the things in being around teachers, there's a lot of perfectionism out there. So what are the realistic expectations of what is possible? Depending on the class that you have, the setting that you have, this environment that we exist in this point, what are the realistic expectations? And sometimes we have to set those for ourselves because there are these lofty expectations being set for us by the profession and by our districts and by the state as a whole. What's really possible to do? Conserve some of your energy for your family, for your friends, and for your pets. Have you ever been so exhausted that you just don't have energy for them? Okay, or you're rushing to get off the phone. I love FaceTime and Zoom because now we can Zoom and FaceTime with our grandkids frequently. But how many times have you had to rush to get off because you got more work to get done that night, knowing that you've got to get things done for the next school day? And so be careful that you're conserving that energy for your family, your friends, and your pets. And I'll tell you a lesson I'm learning. I'm 62 years old, and I'm beginning to realize how fast life passes. It's amazing when I look at my grown sons and I realize I remember playing Little League Baseball. And now with my grandchildren, my oldest grandchild is 8 years old now. I remember when he was just born. And so time passes by quick. We often think there will be time at some point to do these things, but often there's not. So be sure you conserve energy. And then be safe, make wise decisions. The rest is out of your control. How do we deal with this anxiety about COVID and all that's happening in our world? Sometimes all we can do is just to be safe and make wise decisions. Some of it's out of our control. Some of it we can't control. We don't have the opportunity to control. So rather than feeling we always have to be in control, maybe it's just deciding, okay, what is it that I realistically can do? What's the best thing that I can do, even though I can't be in control of everything around me?
And what I hear you saying a lot of, David, is about setting boundaries, like even talking about cutting out some time to have your lunch or cutting out time that says, I'm going to use this time for my family. So it sounds like we're talking about setting boundaries.
Were you talking personally to me, Jessica, about that?
No, sir.
I just had the discussion with Kaylin Alexander, who's on here with us, who works in my department today, about that I need to learn to say no. And so often we do. We need to learn to set those boundaries. So that's very true. And then use mental imagery as a retreat. I put a picture up here. This is at Sanibel, Florida. I talked about as a family, we would go to Sanibel, Florida. And this is at the condos looking out there into the Gulf. And I picked up some shells. And I still have the shells. I keep the shells. I tend to keep one in my pocket. What I do is when I get stressed out during the day, I reach into my pocket and I rub the shell. And as I rub the shell, I remember being there at Sanibel and looking for shells with my grandkids. And it relaxes me. It helps me to remember that enjoyable time in my life. And so you can, even in your classroom, when you have a break, okay, you can take just a couple of minutes to imagine yourself in your favorite place, a relaxing place. You can imagine yourself being with the ones that you love. And it's amazing, again, the release that we get from just that mental imagery of those pleasant thoughts.
Plus, your voice calms down as you talk about that, and that helps.
That's true.
It does.
And then this is a little exercise you can use for your self-awareness. This is the I'm safe checklist. You know, where am I at today? It's being mindful again of what's going on with me. You know, Is there an illness? You know, am I ill today? Is something going on with me? Medication, if you take medication, have I taken my medication? I have type 2 diabetes. I take quite a bit of medication. I have to be honest with you. There are days where I'll get to the middle or the end of the day and I'll realize I didn't take my medication this morning. I've been so busy. So thinking about how does that impact us if we've not been able to take our medication? Stress level, where are we at on the stress level? How stressed am I today? Is my neck stiff or my shoulder stiff? Is the frown lines on my forehead? What's going on with me today? Alcohol and drugs, you know, or am I under the influence of any alcohol or drugs? We know that often when we're under tremendous stress, we sometimes turn to alcohol and drugs. And so what's my drug or my alcohol use like? What's going on with me at this point?
And you know, even to the point where, I'm sorry, where we talked about sleep deprivation, and even just that glass of wine at night can impact good sleep. And so we have to do exactly right, David. We have to be so mindful of those medications that we're taking. There's, you know, even Benadryl may rob you of some of that good REM sleep that you need to feel refreshed. So yes, we have to be very mindful. Thank you for that.
So how are we medicating ourselves? And when we get stressed, do we tend to self-medicate, either with alcohol, with drugs? It could be with tobacco. Okay. Sometimes it's with food. And so it's that awareness, the fatigue level. What is our fatigue level like? And what's going to happen when we're that fatigued? Are we going to be able to be at our best? We're not. And then eating and elimination. You know, we talked about earlier that skipping lunch, and then even just going to the bathroom. Okay, my wife talks about with a classroom full of kindergartners, it's a task to even get to go to the bathroom, right? And so how many days are you at the point where you realize that, gee, I'm hurting because I've not been able to go to the bathroom? And so what does that do to us? What does it do to our performance level? And how does that play a role in burnout as well? So it's really about self-care, taking care of yourself. So I'm going to ask you to think about one action, just one strategy that you might commit to use to take action to either manage or to prevent burnout. So think for just a moment about, of the strategies we've talked about today, we talked about various strategies. What's one strategy that you might commit to? And then perhaps as you return to school tomorrow, maybe sharing with a colleague, hey, I'm going to commit to work on this one area. Will you support me in that? Will you help hold me accountable to that? We always tend to do a better job at behavior change if we have some accountability. Now, not someone to fuss at us, but someone to encourage us. Have you just said no? Okay. Are you eating lunch? And so we want to take some time for some final comments and to respond to some of your questions and perhaps even some questions you have for us today. So Jessica, you want to jump in here? And
I sure do. Thank you so much. And some of the questions that were submitted beforehand, I think are really good, very simple responses that might be helpful for you. But one of the questions was, is there an adverse impact on our eyesight because we spend many hours of screen time? And what can we do to help that? So that's a great question, because were you aware that when you stare at your screen, you blink less? And as a result of that, your eyes begin to dry out. And over time, that begins to cause problems with your cornea. So first and foremost, if you're having visual difficulties, always consult your optometrist and ophthalmologist and let them guide you on what some strategies would be. But I will tell you some very simple tips. Like there's one tip that many use. It's called 20-20-20. And what you want to do is every 20 minutes, look at something else away from your computer screen that's about 20 feet away for 20 seconds. And you're just giving your eyes a break. Another thing you can do is turn the brightness down on your computer screen, because it's a little more stressful to your eyes the brighter the screen is, and also minimizing the glare on it. So if there's any glare, be sure to try to move your computer around and rest your eyes. And the bottom line is, when you finish looking at your computer or doing a Zoom meeting, try not to go to your phone and start looking at your phone. Give your eyes a break. And so I thought that was a great question. And by the way, artificial tears are wonderful, and they're over the counter and they help with that dryness. So that was a really good question. And then there's another piece, and I really like this. How can I avoid feeling anxious and worried about my children getting COVID, especially if they're high risk? That is a great question right now. And it's one that not only are we worried about our kiddos in the classroom, but we're worried about our own family. And many of us take care of our parents at home. And so what can we do about that? So first and foremost, anxious is not going to help any of us. And so manage your anxiousness with facts. So talk to someone who really knows about COVID, what is going on. It is so easy to get all wrapped up in lots of drama and all of the just how severe things, people have received the vaccine and that sort of thing. That is really not good for us to focus on. Let's focus on just basic facts. The CDC offers wonderful facts about how can I protect my family member? How can I protect my child? Very basic things that you do every day. The mask wearing and the hygiene all have shown to be very, very helpful. But with the anxiousness piece, let's just really focus on that and talk some things that Dr. Farmer spoke about, which was we got to understand what we can control and what we can't, and stick to the facts. So one wonderful thing, I know that they're doing studies right now that look at what can we do for vaccinating our children. Right now, Pfizer is only authorized for kids age 16 and above, and the Moderna vaccine is only authorized for age 18 and above. But know that right now there are current studies, and I think that there's hope on the way that will be able to help with our children. But if you have high-risk children, always consult with your child's pediatrician with regard to any vaccine that would go from there. So, David, do you have any further tips around that anxiousness piece?
I think, again, it just goes back to take the precautions that you can take, all right? Do what you can do, okay? And to realize there's only so much that we can control, okay? So again, the excessive worry is not going to do us a lot of good. I would encourage you to spend less time listening to TV and all the debates going on over a disagreement about COVID. Find one source that's been dependable, stick with that source.
Dr.
Thank you.
Farmer and Jessica, there was a question that came through chat. If you don't mind, may I read it aloud so that you can address it? It says, I find it difficult to share emotions and thoughts with colleagues because it often turns into a gripe session. That causes more stress. I try not to bring it home because then I feel stress at home as well. What do you suggest?
That spot on. I understand that completely. Much to the reference I had earlier was I jump on at one particular social media platform where I am in a room with other medical professionals, and it's sometimes spot on. It turns into a gripe session, and that's not good for anybody. And that's when I know it's time for me to pull out. But I think that at the end of the day, for me, it's a trusted friend who will just let me talk. Sometimes it's important just to get it out, but then I need my other person, my significant other, to help me turn those thoughts around. And David, would you like to jump in on that discussion?
Yeah, one of the things is, and I think it goes back to one of those symptoms we talked about of, or one of the causes of burnout is sometimes that feeling that we really can't affect change in the system. And so, my strategy would be to talk about, okay, we can't control some of these larger things that are going on. We don't have the power to do it. What can we do within our small team or within our group to do positive things that would be encouraging and supportive to each other? And so I think it's focusing on what we can do something about rather than what we can't do something about. I always tell my small team, I have a small team in my department, and what I tell them is we can't control everything else that's going on overall in the organization. What we have the best control over is our small team. And what we're going to commit to as a small team is to be supportive of each other and to encourage each other. And so I think focus on what you can do within that small group in order to support each other. Now, I have to be honest with you, sometimes it feels good to gripe a little bit. It's a release. Remember, I told you I tend to pin things up or keep them inside. So sometimes just being able to vent a little bit, and for somebody else to be able to acknowledge that, either saying, I get it, I'm right there with you, or have you thought about this? Sometimes actually as we vent about things, it helps us to actually listen to ourselves and to say, wow, I really hear what I'm saying. I'm much more stressed out than I thought I was. Or, wow, okay, maybe I'm making too big a deal out of this.
David, to that extent, there's another great question on top of that is, what can we do if it's our spouse that's in the same profession and we find ourselves feeding off the negative emotions and that stress? I got 2 words right there: date night. Date nights, I mean, you know, changing the context of the discussion at some point and having joy, finding a way to find joy together. That is helpful for sure.
Our careers are not our whole being. And often what we've done is we've taken and made our careers our whole being, and we put all of our hopes and all of our aspirations into our careers. And I have to tell you, the older I get, the more I realize that this career is not going to be my greatest fulfillment in life.
Mm-hmm.
What's going to be my greatest fulfillment in life are those people around me that I care about, that I love, that I enjoy being around. And so I would encourage you for that couple that are both in education to help each other look for what are those things outside of education that we truly enjoy, that we love doing. Who are those people that we enjoy being with or caring about? What are some activities that we can do? And I'll tell you something that's always helpful. Helping others is always a good way of helping us feel better. And so find some ways to do something outside of education that's helpful for others around you as well.
And David, I think there's one thing that we should probably touch on, and for those who are very concerned that they're walking into depression at this point and really struggling even to get up every day. Let's talk a little bit about maybe some things that we could offer for them to do, some advice around that, because we do know that when we did our survey just now, we do have some folks who are really concerned about where they are right now.
So, again, take the opportunity to be open about that. Within your insurance plan, often the insurance plan will allow for mental health coverage. And I would encourage you to seek out a counselor. You can talk with your primary care physician about the way that you're feeling, and they can help to assess what would be good for you at that point. But seek out a counselor, someone that you can talk with, who's willing to hear those things that you're going through and be objective and give you some good strategies that you might be able to use for that. You might seek someone to talk through your church. If you're a religious person, you can seek someone at church to talk to as well. But the main thing is just not keeping it all inside, but beginning to explore those avenues that would help us to manage it.
Thank you for that. And COVID-19 everything around it has exacerbated lots of issues. And we know that mental well-being has been impacted because frankly, our lives turned upside down in a matter of a week. So we know that there has been a lot of teen depression, and I know that you all have dealt with that and are seeing it and probably have some concerns around that. And that, as Dr. Farmer mentioned, I mean, there are still options for them as well through their pediatrician. And really, many of us who have insurance are able to access even a phone assistance for behavioral health and mental well-being. And even for our teenagers, for our school-age children, there is help available. And it's a big issue right now. We know that suicides are up. We know that there have been more cases of abuse. Everyone is impacted by this right now, but specifically. Did you want to add anything to that, Dr. Farmer?
Well, the loneliness, the isolation, we just came out of the holidays where our holidays were different. For the first time that I can ever remember, my parents were not able to be with us over Christmas. And so I think we're at a point where we're all struggling. My favorite saying is, I'm not okay, and that's okay. I'm really not okay. But it's being honest about not being okay and assessing that, or allowing someone to help us to assess it, and to find no shame in being able to say, I'm struggling during this time. I'm having a difficult time right now. And looking for that source of someone who can help during that time.
All right. Okay, do we have any more questions? We are happy to address. We really appreciate this time being with you all. And I know we just regret that we can't all be in a room together and see your faces and actually get a chance to interact and share some coffee. But thank you for this time that we've had to visit with you.
Thank you so much. And we hope again that you'll commit to at least one of those strategies that we talked about. Looks like we have a couple of questions maybe in the, Caitlin, do we have some new questions?
I believe that everybody's just thanking you all for the presentation today.
You're already doing the appreciative thoughts. There you go. Somebody's already acting on what we talked about today. Thank you so much.
That's right.
Well, thanks so much for joining us. We hope the good news is it's Thursday, so we've got one more day to go, and then we have the weekend. So there's something to look forward to already. So again, thanks for being with us.
Right.
We appreciate the hard work that all of you are doing.
Absolutely. And the weather is supposed to be beautiful, so be mindful and go take a beautiful, wonderful walk if you're able to do that, and appreciate nature and just reflect on everything good, and know that this is not forever. This is temporary.
Very much.
We appreciate it. Thank you very much. Bye-bye.
Bye.